In today's video, we're going to talk about Esmolol. Esmolol is a drug that is not really used in ICU setting, but it's a great drug in anesthesia practice. You want to know all about Esmolol because you might be able to use it every day in your practice. So we're going to follow the same plan as I follow with my other drugs: classification, mechanism of action, the clinical use, the adverse effect versus complication, the special consideration and the interaction, the metabolism, the route, and the toxicity. So let's jump into it, and we're gonna see why I said Esmolol is a great drug for anesthesia. So classification, like most of us we know, all love beta blocker. Yes, Esmolol is a pure beta-1 selective beta blocker, and this is the ultimate classification of Esmolol. Why I say pure? Because it only blocks beta-1, and it's highly selective at beta-1. We have beta blockers that also block alpha-1. Esmolol is not part of that, so its action is very specific, and because it's specific, it's quite predictable, and that's what we love in anesthesia, right? So Esmolol is beta-1 antagonist, is purely and selective. So now, what is Esmolol mechanism of action? Because it's a beta-1 antagonist, beta-1 receptors are mostly located on the heart, so it's going to decrease your cardiac output, it's going to decrease your heart rate, and that action is going to stop on the heart. Now, Esmolol also have some intrinsic property that are specific to Esmolol, not because it's a beta blocker, because it's just Esmolol. It's a special drug. So Esmolol is going to enhance the opioid action. So, which is great, because if you have Esmolol and you want to give your morphine, you know that the effect of morphine is going to be enhanced. So you don't have to be given a higher dose of morphine to achieve your pain control, because Esmolol is going to enhance that property. Esmolol is going to also enhance the propofol action. So it decreases the requirement of propofol. You actually give less for better effect. And this is what we're looking in anesthesia: pain control without having to give a ton of a drug. Esmolol helps us do that. And it also enhances the property of anesthesia drug, like local anesthesia drug, like mivacurium, which is also what we are looking for. And also, Esmolol is great at decreasing post-op nausea and vomiting, and which is a big deal in anesthesia, because you don't want your patient to aspirate, right? You are there to make sure there is a proper oxygenation versus ventilation exchange in the lungs while you are controlling the pain. So you want to avoid aspiration at all costs, and Esmolol is great because it also helps you do that. So decrease post-op nausea and vomiting. So all this property of Esmolol makes it a great drug of anesthesia practice, in anesthesia practice. Now, what are the adverse effects of Esmolol? They are minimal, and like I said, they are predictive because it's a highly selective molecule, beta-1 antagonist. So the adverse effect of beta-1 antagonist, because it decreases the cardiac output, is going to give us hypertension. And we have so many drugs that we can use to counteract that effect, right? Hypertension, and it's also gonna give diaphoresis. Diaphoresis, like when you are sweating. Yeah, these are the side effects of Esmolol, not a bunch. And also complication, you don't want to give Esmolol to a pregnant woman, right? No Esmolol in pregnancy because it's gonna give the fatal bradycardia. So fatal bradycardia. So no Esmolol in pregnancy. Now the special consideration and the interaction. Now with Esmolol, this is probably why we don't see that administered often in ICUs, because you don't want to give Esmolol with your endogenous catecholamine. When I think of endogenous catecholamine, I think of epinephrine, norepinephrine, which is the level that we're giving dopamine. You don't want to give that with that because a very fulminant pulmonary edema and irreversible cardiovascular collapse can happen. So never. And this is probably why we don't see that given in ICU. So risk of cardiovascular collapse and pulmonary edema when given with norepinephrine and dopamine. I made a video about dopamine. If you haven't watched it, please go and watch it. There is a tons of information you can get from that video. So you never want to give Esmolol with these drugs. Now let's look at the metabolism. Now, Esmolol is also a great drug for anesthesia because most of our patients come, they have past medical history, they have renal disease, they have kidney disease, and we also have to take all that in consideration to choose the appropriate drug to give them. Now, with Esmolol, if your patient has renal failure or hepatic failure, you do not have to adjust the dose, which is great because Esmolol metabolism is in the red blood cells. It's actually the only beta blocker that has its metabolism in the red blood cells. So metabolism is gonna happen in the red blood cells by the esterase. Is a group of enzymes in the cytoplasm of the red blood cells. So these esterases are going to metabolize Esmolol. No need of adjustment in renal or hepatic failure. Also, Esmolol is a great drug because in anesthesia, it's fast in, fast out. So its half-life is about 9 minutes. And its onset is 3 to 5 minutes. So when you give the drug 3 to 5 minutes, it starts acting in about 9 minutes. Almost half of the drug is out of the body, which is great. And this is why I moved the talking about the use later, because this property help us give Esmolol in anesthesia during induction, intubation. And when you have some dysrhythmia during your case, like if you have AFib or A-flutter, Esmolol is going to be the great choice because it acts fast. 2 to 5 minutes, you can see the result. And after 9 minutes, almost half of the drug is out of the body. So these are the use of Esmolol, and you don't need to adjust the dose in kidney or renal failure. Now the toxicity, because Esmolol acts so fast, it's clear so quick from the body. So typically you don't see toxicity with Esmolol, which is also a great drug for anesthesia. Now any anesthesia provider must know how to give Esmolol because it's such a great drug. It helps so much. So I'm gonna give you how Esmolol should be given in anesthesia. I'm sorry. So it's gonna be given every 5 minutes. So the first 5 minutes, the second 5 minutes, and the third 5 minutes. So on the first minute, it's gonna be a bolus dose. So on the bolus dose, you're gonna give 50 milligram per kg. The bolus goes in 1 minute. So you give this in 1 minute, and then, oh sorry, you're gonna give the bolus of 0.5 milligram per kg for 1 minute. The bolus is always gonna be 0.5 milligram per kg. Now, and then you're gonna give 4 minutes of continuous infusion of 50 mics. No longer milligram, 50 mics per kg per minute, and you're gonna give this for 4 minutes, and this makes your first 5 minutes. So first 5 minutes you give the bolus of 0.5 milligram per kg for 1 minute, and then you follow it by 4 minutes of 50 mics, no milligram, mics per kg per minute. Second, you give the same bolus, first 0.5 milligram per kg, and then you follow by 100 mics. So you increase the dose by 50, 100 mics for 4 minutes. Now the third bolus dose, you still give the 0.5 per kg per minute milligram, and then you follow by 150 mics. So your continuous infusion should be always be increasing by 50 mics, but your bolus dose is the same dose, 0.5 milligram, not mics. And you can only give a max of 3 bolus dose, and your max infusion is gonna be 200 mics per kg per minute. So you need to know this by heart, because it's just gonna be unfortunate that such a great drug is gonna be helpful, but you don't know how to give this, right? So I'm gonna extend on this again. Bolus is always 0.5 milligram. You can give it up to 3 times, and then followed by continuous 50 mics, and then increase to 50, 100, and then increase to 50, 150 mics for the 4 minutes. And the max continuous dose is 200 mics per kg per minute. So guys, this is what I got for Esmolol. I hope I was able to condense the actions and specificity of Esmolol. If you like this video, please share and subscribe, and put your question or your comment below. If you want me to talk about any other drug, please feel free to ask. Put a comment down below, and I'll be glad to do so. I'll see you on my next video. Thank you.